This is a Socialist News and Views special interview.
I'm Nick Schillingford, coming to you from the Urban Cabin Studios in South Minneapolis with this special interview. So on Socialist News and Views, we let folks introduce themselves. Do you want to just tell our audience who you are?
Sure. Hi, everyone. I am Emily Birnbaum. I am a family nurse practitioner. I'm currently in school to become a psychiatric nurse practitioner, and I'm an organizer with the Debt Collective. I'm organizing for Medical Debt Abolition with the Debt Collective, which is an organization that's working towards debt abolition in all sorts of different groups. So many people know them for working on student debt, but also work on housing debt, and I'm currently on the medical debt abolition team. So nice to meet you.
Yeah, absolutely. Actually, no. So November 20th, 2024, I was on a call. The title of the call was Jubilee School Fund Healthcare, Not Genocide, which was also hosted with Healthcare Workers for Palestine. It was called by a debt collective. You spoke on the call. There was a number of other healthcare workers on the call, including some who had worked in hospitals in Gaza. And in that call, you spoke about pouring your heart and brain into your patient care. And then you said, quote, a portion of my paycheck that I just got for trying to better my patient's life, or maybe try to save my patient's life in an acute scenario, just went to weapons that are going to go and kill patients in Gaza, or my colleagues or doctors who are doing the same work, who are risking their lives for their patients, end quote. You ended by saying you were angry that you didn't live in a society that was democratic enough to allow you to say, no, you don't want your tax dollars going to genocide. Can you talk about that, how you're feeling at the moment and what you've been thinking about this, this feeling of wanting to care for your patients, this feeling of anger at the U.S. government since the Jubilee School?
Yeah, thank you. And yeah, thank you for pulling that quote. Yeah, I mean, how I think about it. I mean, obviously it's summarized well there. But you know, I'm someone that I deeply cares about people. I went into medicine because I wanted righteous work that I could make a living with, which is very hard to find, right, under
Right.
capitalism in this country. Um, and it feels so terribly, horribly ironic that,
Mm.
you know, part of the money that I'm making in this country is, trying to save lives and trying to better lives with my patients, is going to do the exact opposite, right? It's going to
Mm.
kill people, kill children, in Gaza because my government is funding and giving weapons to a country that is committing genocide right now. Um, and yeah, I mean, I think in general, as a nation, we need to think about democracy and we need to think about the fact that we don't get to vote on that. And actually, we have a responsibility as a people to hold our government accountable. And yeah, it would make me really angry when I would work these long nights and I would be, like I said, pouring myself into medicine and pouring myself into my patients that the tax money on that was going to do the opposite of that. And I just have righteous anger about it. One of my colleagues at my old job, I'm in school now, but my old job, one of my colleagues is Palestinian and her husband is Palestinian and his family is from Gaza and he's lost dozens of his relatives.
Mm-hmm. Yep.
And the only thing I can imagine for some people is they just know no Palestinian people or they know no Arab people or no Muslim people if they can't have any ounce of empathy for what's happening. Like that, like I just, it's so anyway. So how I've been feeling is the same basically, right? But also, trying to figure out how we're going to keep fighting. Healthcare Workers for Palestine is an amazing organization of doctors and healthcare workers who are organizing at their institutions to, stop the genocide for free Palestine. And so if you're a healthcare worker, I'd recommend looking them up and joining a chapter near you.
Yeah, and I the democracy piece, it's like, there was a lot of like shaming of people who, weren't going to vote in this last election or didn't feel like they had somebody that they could actually vote for. And when they were talking about, saving democracy or about, just democracy in general, a lot of times I kind of was asking the question, at least in my head, like, okay, well, who am I going to vote for, if I want to end the genocide? Who am I going to vote for if I want, single payer universal health care for everyone? It's like, not, they wouldn't even agree. They wouldn't even say like Medicare for all or anything like that, which is already like a watered down version of, single payer universal health care that, people have been demanding. And so it's like, where's the democracy if there's nobody, and that's why I think it's important, the work that Debt Collective is doing, to use the power that people have, to combine together to take on these issues. I don't know. Do you have any other thoughts on the democracy piece at all, or?
Yeah. I mean, I think that's something that's really important for us to start thinking about in general. Like, I think that's part of building class consciousness is to think about how undemocratic our country currently is, especially when we espouse, our government espouses the fact that we're this grand democracy all over the world and uses
These
that
lofty ideals.
to enter other countries for imperial regions. I mean, reasons, right?
Yep.
When in reality, there is so much that we don't have any control over in government, and that we should be still voting, right? Like we still want to use and protect the amount of democracy that we do have, but but we need to understand that it's very limited and that we need to be fighting for more democracy. I have a really good friend who he's like obsessed with the idea that we need a new constitution, that we need like a democratic constitution. He has like the Democratic Constitution podcast and
Nice.
really influenced me because he talks about it all the time.
Check that out.
Yeah, but anyway, so I do think this is a crucial question and something we need to be thinking about, and we need to be demanding that we have more democratic, more democratic government. We need more than two parties, for instance.
Absolutely. Yeah, and then the Constitution piece, I think a U.S. Constitution, is it the oldest? If not the oldest, it's certainly one of the oldest constitutions in the world, having not been updated since for a long time, let's say. But I mean, the original document is very old. That call that we were on, the Jubilee School call, had a lot of great speakers. It was a really good call. I was really impressed with all the people that were on there and all the important pieces of the puzzle that were put together. Included in the call was Dr. Ahmed Abid, who worked in Gaza. And I've spoken to people from Gaza, both in Gaza during Israel's current year of bombardment, and then folks from Gaza who live in the U.S. now for some time. And as I'm sure you're aware, honestly, people who have been face to face with this trauma and been dealing with this for a long time now are pretty tired of talking about it, especially since we don't see very little real action going on that's slowing or stopping this terrible genocide. So in addition to the memorable words, I wanted to highlight the important work. Debt Collective, as I mentioned before, is doing a lot of great work, but specifically connecting the debt, healthcare, the Palestine struggle, all this stuff together. I think that's really impressive. Debt Collective came out of the Occupy movement, as you mentioned, has focused on student debt work for some time, but now it seems like with you and everything, they're pushing outward, really to make connections. Can you talk about all the ways Debt Collective is building the challenge to the current system, and of course, including healthcare? Your focus, how are we going to challenge this? How are we going to get rid of this healthcare debt?
Thank you so much for that question. Okay, so yeah, Debt Collective, came out of Occupy Wall Street. And so, I can tell you sort of how I ended up joining, based off of the kind of what drew me to it. I've been a leftist for like over 10 years. And obviously, any good leftist understands the importance of labor and a labor strike. And what was intriguing to me was I went to the socialism conference that's in Chicago every year that Haymarket Books puts on. And that was my first kind of introduction to Debt Collective. I have a friend who works for them. And so I went to a bunch of the panels and I was so impressed with everyone who spoke. And Basically, the theory, the thought of it is, in this late stage capitalism with, financialization as this, huge industry now, so many of us are debt financing our lives and for basic needs that we have, like healthcare, like educate, we need education, right?
Right.
And housing, right? There's tons and tons of housing debt, carceral debt. I mean, the
Mm,
list goes on. And the idea was that, first of all, debt is a area to organize around because so many of us are in debt and so many of us are crushed by debt. And so this can be a place of connection and a place of sort of a lens in which we can view the system to connect the individual with the structural, right? And so that's part of it. But the other part is that there's potential power there because if we think about the amount of debt that Americans owe, you could imagine the power in getting together as a debtors union, which is the ultimate goal of the debt collective, of doing fomenting massive debt strikes. And the book that the debt collective, by the way, a book if you want to kind of read the theory behind what the debt collective is can't pay, won't pay. And that kind of goes into this. But, there's a history of jubilees. There's a history, hundreds of years of like people rebelling around debt and refusing to pay and debt being canceled. So this is not like a new idea. This is something that's been done before throughout history. And so, yeah, so the idea is ultimately organizing around debt, how this like political education, bring people together. How can we build class consciousness through this debt lens? But also how can we build power, And I think that's something I spoke about on that call too, that power only concedes to power. We really have to think about building power in general. We need to learn the system so that we can fight the system successfully and win. And so it's never that, debt strikes over labor strikes. It's both. It's yes and, right? It's like we need all the different ways to organize in such a catastrophic system that is capitalism. And especially now with the Trump administration coming in, it really feels to me like all hands on deck. And that goes back to our call where I feel like we also need to be building, like this is a solidarity building time. Like I don't know if you felt this, Nick, but there's this kind of atmosphere I have felt right now around people in different organizations and people on the left or liberals too, who are
right.
just like, okay, what we've been doing hasn't been working,
Right.
right? Like
Right. Right.
we have to get together. Like we have to get together. And so I
And I'm
can
glad
talk,
to see that because what they've been doing isn't working.
right, exactly,
So
right?
it's like very nice. And I mean that not just liberals, but there's plenty of people on the left, and what they've been doing is not working. So
Right. And we have a campaign coming up, which I can talk about, or like that can be later too, if there's
yeah,
anything
I
else.
was just gonna say, yeah, I mean, you're speaking my language as far as like things I want to see more about. You talked about the like financialization of capital, and I think that's something that doesn't seem to get discussed as much. Even though you understand capitalism, are you really understanding the financialization of capitalism, like you're saying? And then the other piece, the power piece, is another huge piece. I feel like a lot of times we're directing things not necessarily the right way. I feel like some of us need to get together and work on like a giant power map to figure out like where we should be applying the pressure. And I'm sure some people are doing something along those lines, but like the ruling class is just so like on each other's boards and at each other's meetings and at each other's parties. Like they're so like they're actually pretty weak. The more that the capital gets concentrated in a few hands, they actually get kind of weak, and all these like billionaires are arguing with each other and fighting over who actually controls the government. So I think yeah, this is the great time to do that. And I'll just throw in one more. There was that quote from the that you had shared. I think it was J. Paul Getty. The if you owe the bank $100, that's your problem. If you owe the bank 100 million, that's the bank's problem. And I think that gets to exactly what we were just talking about, the importance and the ability to have a debt strike and to organize people around that debt. Yeah. What else? Yeah. Anything.
That leads perfectly into kind of what I was going to talk about with our upcoming, basically like an organizing drive. So I love that you brought up power mapping because that's essentially like what we're trying to do at the Debt Collective and specifically on the medical debt team. We're just all together in New York in a kind of an intensive retreat where we were doing that. Like we had like papers up and we're drawing and power mapping and our organizing drive. So it's gonna start on the day of the inauguration, and it's gonna be 100 days of building debtor power. And we're gonna do it across debt types, but because I'm on the medical debt team, I'll just speak on that. So essentially it's gonna be kind of a number of things. So it's going to be a lot of power mapping. So just like you were saying, like we believe that's so important. And so a lot of it's going to be like political education series, similar to the call you came to, Nick.
Sure.
But it's gonna be kind of a combination of things. We're going to be power mapping the health insurance industry, which of course is getting so much attention right now after the
And just to interject, I guess
yeah.
I didn't like say what this means, and I like to try to make sure that
Oh, sure.
but
Thank
yeah,
you. Yeah.
power mapping, is this visualization tool that helps you see, how different organizations or entities are connected to each other, and then, how you can find, levers in there or between different relationships to gain access and influence over, to actually gain some power over your environment. And so, yeah, connecting who's on whose board and who's related to who and all these other pieces that can help you gain kind of like really target specific individuals that have that power when you're doing a campaign. Anyway, sorry, continue.
Right, just trying to figure out who has power and like how to organize in such a way where you can be most effective. And so well yeah, so and not just individuals but also just systems and
Mm,
but so and we've been doing that. So we want to do a political education series on power mapping health insurance, power mapping pharmaceutical industry, power mapping the hospital industry, and just for so people can get an idea of kind of what we're up against in terms of trying to build for a
right.
national health system where the profit motive is out of healthcare, where everyone has a basic human right to healthcare, which is what I believe in as a clinician. And, I don't believe my patients should go into medical debt. I don't think medical debt should exist. And so
Agreed.
Right. So that's going to be part of it. It's going to be just helping people understand the industry, how much capital is in our healthcare industry in this country, and
Mm,
why it's been so hard to pass Medicare for all and so hard to pass these bills to win a national health system, and why it's failed is because there is so much power and there is so much money.
yep.
And so, yeah, and so we want to do that, and then also building up leaders to organize, and then we're gonna end that kind of organizing drive. And we're also looking, and this is something that if anyone's listening who has medical debt, please email me at emily@debtcollective.org. We're looking for 100 medical debtors. We're gonna do kind of narrative campaigns. There are 100 million Americans with medical debt, and so we want these 100 medical debtors to represent the 100 million.
Mm,
We want to create, yeah, campaigns for people sharing their stories, whatever people are comfortable with. And so if you either have medical debt or you'd be interested in like building with us, either in solidarity as a healthcare worker, I'm also going to start regular meetings with doctors and clinicians to be in solidarity with patients. That's a big vision of mine too, is this like movement of patient and clinician and doctor and healthcare worker solidarity, because so often we're pitted against each other because we don't have enough time. We're running behind, we're overwhelmed, and our patients aren't getting what they need. And we're all suffering, right? Just so that some fat cat at the top can get rich. So I really believe like in this like a solidarity movement between patients and healthcare workers. So if you're a healthcare worker, or if you're someone with medical debt, or you have a family member, or you just want a national health system, and this seems like a great way for you to organize or a great place for you to tap in, then just email me. Um, or go to the debtcollective.org and find ways to tap in. There's tons of events and campaigns. But yeah, and then so we're going to do that. So we're finding the medical debtors, and we're going to do these political education series for the first 100 days of Trump's presidency, and then that's going to end the day before May Day, and then
mm,
we're going to go out for May Day, hopefully with like
nice.
healthcare union
Yeah.
and things. That collective, and that will be the end of this specific campaign. Obviously, then we'll be kind of growing into something else after that.
Yeah, that sounds amazing. That sounds awesome. And I think, that's going to be necessary. I think what people need to be doing wherever they are is connecting with one another. When I was in the Minnesota Nurses Association, a lot of what I was trying to do when I was the most active was, yeah, connecting healthcare workers, with patients, with people in the community, with other healthcare workers that may or may not be unionized, and that's what we need to be doing, because, the more that we're on the same page, it cuts across their ability to lie to us, their ability to, divide us and pit us against one another. And, so building those relationships between different movements and people, that even, they come from different backgrounds, different trajectories with different ideas. People, that have immigrated to the United States from other places. They have seen all kinds of different organizing forms and formulas in the past. And so, I think so many people have actually amazing things to add to the struggles that we're all encountering. And I encourage folks to get involved with the Debt Collective, especially, folks, if you have medical debt and, this is something you want to be active in the fight against this, and to win a world where we don't have to deal with this, which is just, I agree. It's absolutely ridiculous. And it's so frustrating, and just trying to get something done for somebody. You've got the health insurance companies that are standing in the way. And then, even when you get it, it's still not even really covered. It's still like, I was just talking to somebody who's going to go, and this is a healthcare worker who's going to go get surgery, and they're talking about paying like 20% of it out of pocket or whatever. And it's like, plus they also have to like set up some of their own like connections between different like anesthesia and some of this other stuff. They have to like set it up and make sure it's working. And it's like, it's so ridiculous the way that this works here. And I really hope that Debt Collective, Healthcare Workers for Palestine, different healthcare unions can really take this on in a big way, especially starting in 2025, when we can identify a common enemy and really put some pressure on that big guy who he's got a big ego too. So people are saying that could potentially be a big positive for us, is how big his ego is in certain situations, and how we might be able to really put some pressure on him in different ways than usual. Maybe, I don't know if that's true, but it'll be interesting to see if we can we got to use all the tools at our disposal. So I'm really glad to see that Debt Collective is banding people together and building this pressure that millions of dollars in debt can have on these groups. I have $100 of medical debt right now. It was 50, now it's 100. And I still get a call like every other day, and that's just for $50. About, like, I get calls from their, every call's from like a different place. It's all, this is from our business office, and this is from, your local clinic or whatever. Oh, this is just me. It's like real people and machines and letters and emails. It's funny. And that's just for $50. So I can't imagine what people that are, dealing with millions of dollars, I'm sure they get a call at least every day, many times a day even.
And they can be really harassing and threatening. Right. I mean, the debt collection.
They'll show up at your house. I mean, I had a neighbor who's had somebody show up at their house for debt, like knocking on their back door and stuff. So
yeah, so like we were going, if Harris had won, we had kind of a different plan, which was going to be using some of these government agencies who there are people within them that really, really actually care about these things, like the CFPB, the credit, the Consumer Financial Protection Bureau. They've been working on trying to get medical debt off of credit reports, like nationwide, making that like a regulation. It's not possible. And then imagine the power we would have if medical debt couldn't affect credit, we'd have even more power to not pay, right? Because it wouldn't affect.
And that's something we have here in Minnesota.
Okay.
I'm in Minnesota. Okay. So this would be a great place to potentially get some folks on that, because already in Minnesota, at least, it can't affect your credit. So, that would be a great starting point.
But then with Trump, it's like he might be gutting all these agencies. We don't know. We can like use some of them feels maybe less likely, or much less likely. And so instead, sort of our shift that's why we're like, we just have to build mass power, which is like always what
right.
do, but kind of even more so it sort of forces our hand, right? We're like, this is actually necessary. Like we're not going to be able to do quite the wonky things we were hoping to do. Now it's really like we just have to build power.
I think everybody's realizing we have to be on the offensive, right? This is going to be, I mean, we already saw what last time was like, and it's Not going to be any better this time, I don't think.
Yeah.
So, you know, and like you said in the beginning, that's what everybody's feeling, right? Is like, we
Mhm.
need to do this now. Like, whether their timeline was, oh, this is how we do it. And,
Mhm.
you know, when we have this many people or in 5 years or 10 years, like everybody's like, we need to do something now. And we need to do a serious assessment of where we're at and what we need and who's on our side and all these things, right?
Totally. Well, and one thing I was just thinking about when you were talking about all the medical debt, and then talking about the fighting with insurance and all the administrative labor and things like that. Another thing I think I talked about in my talk that I don't know if you remember was what's even like it's maddening no matter what, but what's even more maddening is the amount of administrative waste
Right.
is greater the amount of debt that Americans owe. So we're paying back these institutions that are wasting our money, and
Right.
people are going, bankrupt to pay back a system that we shouldn't that is failing us.
Right.
We
That's true.
so I'm sorry, but it doesn't make any sense. Even under capitalism, it doesn't make sense for
Right.
how much waste there is.
Right. Right. Right.
Like even under
No,
capitalism.
it's true. It's true.
Um,
I mean, yeah, it would
so
save money. Medicare for all would save money, and even a you know, a more robust single payer system would save money over time, because again, you're not you know, you're trying to prevent people from being sick. There's not all this administrative waste. I remember I was in a car accident in 2008, and I remember them asking me for my insurance card, and I told them like a million times I didn't have an insurance. I didn't have my up to date insurance card, and they just like were adamant they wanted to see the old one, and I was like, well, this isn't right. So just so you know, and they're like, oh yeah, yeah, we got that down. So I wrote it all down, and then I gave them the new insurance card, but they never updated it. So they sent me this like huge packet of information afterwards that had like the old insurance information on it and about billing and how it wasn't working and stuff. And I was like, I called them, I was like, that's not the right thing. So then they just like update the insurance and they print off another huge stack of stuff, like update it and just ship out another big pack of information out to me. You know, it's like this is the kind of, and everywhere does that, right? It's like every hospital has their own setup for you know, all this waste, and then they don't talk to each other. You know, you have to manage that. There's so much stuff that's lost in between the different hospital systems and between the different care systems, and there's not any like consistency of care. I mean, that's the other thing. There's not like a consistent approach to the care across
yeah,
systems.
there's literally associate's degrees in insurance
Right,
billing because
right.
it's that complex. And like, honestly, respect to the people that do that. I know it's hard and frustrating. I just would want those people in a national health system to get to do important administrative
Yeah,
work that's for public health, like
right,
national public health, and isn't just learning these things that shouldn't exist.
right.
Right. I mean, and I can't tell you the amount of waste it is on our system for the time for a clinician to have to argue with insurance. I mean, it's so frustrating when you're like, my patient needs this and insurance won't cover it. And you're like, what medical degree do you have? I mean, all that
Right,
stuff just came out on United Health where they were using AI,
right.
well, a literal computer, like to do these denials.
And
I
it's
mean,
life and death. And they're
maddening.
using AI, and they're using AI in Israel too to focus in where they should bomb with drone, you know, with
Right.
drones
And
or
then they can
planes or
wash their
whatever.
hands and say,
Yeah,
oops, we didn't make that decision. It was the computer. Well, you are using a computer for profit.
right,
So it's still, the buck still stops at you, right? Whoever's in charge of the military, whoever's in charge of this insurance company, who's ever in charge of, the hospital system, like, like all, and it's so hard because, I mean, it's just so hard when it's these systemic problems, it's
right,
really not usually an individual, right? It's
right,
it's truly the whole system. But then, there are people that are profiting off of it, and they, and so we need to be diligent in our organizing, and like that's why we need a power map, and we need to get together. I think part of our 100 days of building 100 our 100 days of building better power will also we're also want to do like solidarity events like we did
nice,
for Palestine. I think like, there's going to be certain groups of people that are going to be under a special threat, especially
right.
immigrants and our trans brothers and sisters. And so
Mm-hmm.
we're thinking a lot about that too, of sort of who do we need to be building solidarity with? Who do we need to be standing up for? Um, one of our like lead organizers, Lindsay Munyak, who's brilliant, brilliant. She has spent so much time doing this, but she talks a lot about the fact that we don't want to leave anyone behind with our
Right.
organizing. We're not going to sell anyone out. Like our 100 medical debtors, right? We want to have any kind of person that wants to be a part of this. Like there's no capitulating to the right? Our trans brothers and sisters are just as important as anyone else. Same with our immigrant brothers and sisters, right? It's like
Absolutely.
solidarity, solidarity, solidarity to the end. Like that's
Yep.
it. We have power in numbers. Um, you don't leave anyone behind.
I agree with you. And just one other piece on the public health side, you mentioned public health. I mean, we saw with the pandemic that another piece that suffers from all these different systems, all these different administrations that don't communicate is like there really is very little to no like actual public health infrastructure in this country. At least federally, it's pretty poor. A lot of it is like what county public health stuff, which is like seems like another kind of weird way to do it, especially in a country as big as the United States. But anyway, yeah. So there's all these pieces. I think we need to figure out how to like. It's weird because I feel like a lot of people agree with a lot of these things, but I don't know. Like, it seems like if you say certain words, they are avoidant. But then if you frame it in a certain way, it's like, well, duh, that's obviously how it should work. So like, just like figuring out the clearest, most concise way to frame this stuff, I think is going to be important too, potentially. Just to get everybody on board and make it really clear. Because I mean, sometimes again, like even with the power mapping and stuff, when you come from a labor background, you're like, oh yeah, power mapping, or you come from, you're like, oh yeah, power. But it's like when did I actually know about power mapping? I'm not sure that I was that familiar about power mapping at a certain point. So we got to make sure that we're, speaking everybody's language, so to speak, and make sure that everybody's on the same page and understands what we're talking about. Acronyms are another bad one that are way too overused that we need to work on really hardcore to make sure that everybody is understanding everything that's being said so we can be educating everybody like as equally as possible.
Yeah, totally. I was gonna say, like, I also think that's kind of a strength, I think, of the Debt Collective, and I'm sure some other orgs too. I think like there's been in the healthcare organizing world, it's sort of like either kind of just like charity, like trying to
mm,
get money for people, or Medicare for all legislative, like building around legislation, and
right.
then like kind of not anything in between of how to tap in and organize. And I do think that's a strength of our team is like we need to find sort of in between steps to organize around to try to build power and try to build wins.
Mm,
And I think that's really necessary. Like we can't only just like be fighting for Medicare for all. That's our ultimate goal. We believe in a national health system. But what are we doing in between? One campaign we've been wanting to organize around is the fact that nonprofit hospitals get billions of dollars of tax breaks to give charity care, right? So this would be
right.
trying to prevent medical debt rather than just
Yep.
cancel it.
Yep.
And yet don't give nearly the amount of money in charity care that they are actually legally obligated to, which ultimately, again, if we had like under a Harris administration or not under Trump, we
Right.
were imagining trying to pressure federal agencies to pressure nonprofit hospitals
Right.
about their tax exempt status. That might not be possible under Trump, but still just like letting the public know, like a know your rights campaign around like if you are under a certain income bracket and if your hospital, which is the majority of hospitals, is a nonprofit hospital, you actually legally may not have to pay. And yet, so many of those hospitals don't let their patients know, send bills, send it to collections, which sometimes is illegal.
Right.
But they're doing it. And so like that's an example of like an in-between step, right? Where there's things we can look at if we power map and see ways we can be organizing that isn't just Medicare for all, which we want, and which is
Right.
always the ultimate goal. But we need to think about the in between steps because I don't think we're just going to be able to vote it in.
Mm,
Uh, I do
right.
think it's going to take power.
Well, yeah, and I keep coming up with new things to say. So, but
Right.
and that's something I do like about Debt Collective is they're like hitting it at all these different points. You were talking about like the people going in and putting pressure on these government agencies to do the right thing. and another thing I think is like highlighting our wins. When they have been able to get these agencies to do things, that's been like kind of highlighted pretty well, which I think is something that's not always done as well, because I think people seeing that we can win is like also one of the biggest ways to transfer them from like the apathetic or terrified or just not interested in being
Naive.
involved into like, what was that?
Or naive.
Yeah, or naive into like the area of like, oh, okay, this is like actually a real thing and we can actually win here. And I think the other piece about, yeah, like really putting pressure on the government agencies to rein in, corporate America or whatever, that is a strategy, and it does have a history. You saw I don't know, the most famous examples of this on a large scale, like with like Nader's Raiders, who went into government agencies, what I think in like the 60s
Wait, I don't know
kind
if
of
I know
time
about
frame.
this. Can you explain?
So
Yeah.
Ralph Nader,
Yeah.
he he was a really well-known person at one time, and he I have a couple documentaries that cover him, and I can't remember which one this is in, but I mean, Nader's Raiders, so-called, were a lot of them were like lawyers or law students, and they went like to these government agencies and used whatever tools they had to, like, yeah, like you said, put pressure on them. So like they kind of got together as a group, and they're like, okay, three of you are going to go and like target the consumer protection agency and just continue to like, legally try to tell them what they need to be doing and like highlight where they might be failing, especially legally. And then on the other side, and then you're going to go to the United, Department of Agriculture or whatever, and highlight where they are failing on, in the environmental, because a lot of these, it was seen that a lot of these organizations weren't really doing anything. Basically, they were just entirely in bed with corporations at that point. I think we're getting a lot closer to that point in the U.S. today again. But
Yeah.
there was a period in there somewhere, theoretically, where they actually felt like people were paying attention and they had to actually do things. So I think that's an interesting example, and I think I think there are things that can be done. And you were talking in our previous conversations before we were on this call, because we did talk briefly about how Debt Collective was kind of putting them on blast, basically, like the government, like, oh, here's what Biden administration would do if they wanted to cancel, this amount of debt or whatever, and they would continually put that out there to make it clear that, when certain politicians say like they don't have power in a given situation, they, may be lying, or they may not fully understand what they can or can't do or whatever, because they also have a lot of lawyers and whatnot. And I know whenever you're in a position of power, there's always lawyers and other people around trying to tell you not to do
Yeah,
anything
well,
good.
with student debt in particular, the federal government is like the main, what is it, the main creditor. And so
Right.
like it's that, which is different than medical debt, which is why we
Yeah.
can't quite do the same kind of campaign for medical
Right.
debt. It's not who hold, our government
The
isn't who
government
holds
doesn't
it.
hold the debt
We
here.
have agencies that could help with regulations. And actually, just FYI, the CFPB didn't exist back then. I think it's a project that came out of Occupy with Senator Warren, or I believe probably was influenced by that, but Senator Warren created the CFPB. But what you were saying though kind of made me think about, in some ways the right is doing that, right? Like
Right.
Trump is kind of doing that right now. And one thing I've thought about is like on the left, I think because we're so frustrated by our government, of course, and have so much critique of our government, there is a bit of like not engaging with the government at all, like just like F the government, which
Right.
makes a lot of sense for a lot of people who suffer under our government. But I think it's also when we don't engage at all, we leave this opening for the right and for just like the private sphere to just kind of take over. And I do think thinking about ways we can, there are some good federal agencies that we need to regulate, the incredible greed of the private realm. And so that's been something I've thought a lot about, how, the rise of the right and Trump, there's, drain the swamp and all of this. But a lot of he's a billionaire. I mean, it's not going to be the people that need to be drained are not going to be who's going to be drained under Trump, right? It's going to
Right.
be
Right.
people who actually really like good government employees that want to do right by the American people,
Right,
like people
right,
who work for the EPA, the Environmental Protection Agency, and people who work for the Consumer Financial Protection Bureau. And we actually need to fund the IRS because they can't even go after billionaires because
right.
they'll just be drained of resources from billionaires fighting back with immense money to just drive any sort of any legal issue into the ground. So we need the government, right? I'm a socialist. Like, of course,
Right.
I believe that. We just need it to be democratic, and we need it to not be controlled by billionaires and politicians who are just, who don't take any working class issues into the front of their minds, who are control. So, anyways, that was just a thought I had.
Yeah, yeah, yeah. I was just gonna say I looked it up real quick. Yeah, so it says the activists that became known as Naders Raiders helped establish a number of advocacy organizations, most notably Public Citizen. They were involved in
Oh,
such issues as nuclear safety, international trade, regulation of insecticide, meat processing, pension reform, land use, and banking. So
amazing.
they those were the I guess those were the focuses. But yeah, anyway, a lot of that was legal means. So I mean, there's a lot of different directions we can be going at all these systems and people that make up those systems. And I really appreciate all the work that you're doing and that Debt Collective is doing. And I really hope to attend some more of these events and hopefully can make folks aware of stuff that's going on with Debt Collective in Minnesota. If there's other stuff going on and there's a need for support and folks out in Minnesota. I really appreciate you speaking with me. Is there anything else you want to say before we go about the current struggles or how folks can plug in with Debt Collective or get active?
Yeah, I mean, I can repeat sort of how to plug in, and then yeah, I'll
Yeah,
just so yeah, if you have debt, or if you want to organize around the debt question, if you have medical debt in particular, feel free to email me, Emily at debtcollective.org. If you just want to plug in and join our union in general, or student debt, if you have student debt, then just go to our website, debtcollective.org, and it's pretty easy to navigate. There's events, there's working groups. You can just go and kind of choose where you want to plug in. We have like a debtors over 50 working group. We have a disabled debtors caucus, which you could join. So yeah, go to our website, or you can follow us on Instagram, Debt Collective. Just look up Debt Collective. It's on TikTok as well. We post events and things that way. And then, yeah, I would just say, my solidarity to anyone listening. How I've said this to some of my friends is it feels like the beginning of the fight to save the world right now. I mean, I do think there's so many things that are so bleak and so scary. Climate change, the genocide going on in Gaza. Um, I just hope all of us can feel, empowered that like this is the fight of our lives, and we all need to get together however we can to fight.
I really appreciate that. I think we should put some things on posters like that with about the fight of our lives and about we need to get some more artists involved. I really appreciate your time and I appreciate everything Debt Collective is doing and encourage everybody to check them out. Thanks so much.
Thank you so much, Nick.
Yep. And that was our special interview. Thanks for listening. Solidarity.
This has been a Socialist News and Views special interview.